Hello, welcome to Behavioral Health Behind the Scenes. I'm Kimberley Quinlan, a licensed mental health professional in California with specialized training in OCD and eating disorders. On this show, you'll learn firsthand how leading healthcare executives navigate the ever-changing behavioral health industry. We aim to help you build a strategy that empowers your organization to do good clinically and well financially. Enjoy. Well, welcome back. I am so excited to have here with us today Solome Tibebu. Welcome, Solome.
Thanks so much, Kimberly. So glad to be here.
Yeah, so for people who haven't, experienced your greatness yet, tell us a little bit about you and what you do, your background, all the good things.
Sure, yeah. Okay, I'll try to give you the abbreviated version, but basically, I had really bad anxiety and OCD as a teenager, really struggled with obsessive thoughts and compulsions around a sprinkling of a lot of the common ones that you hear about. Harm and scrupulosity, sexual thoughts, family, but really the main one was fear of something bad happening to my family. And so yeah, I struggled with that for a while, and my parents didn't really know what to do, but were trying their best to get me the help that I needed. And so eventually tried different therapists and different medications, but found somebody who specialized in OCD and could finally figure out, oh, okay, what's going on with me? And throughout that process, I remember going to Barnes and Noble as a teenager and reading all sorts of books about what is OCD and anxiety. And I thought, wow, wouldn't this be great if teens everywhere had access to this kind of psychoeducation? Because it was really helpful for me. And so that's when I started anxietyandteens.org in 2006, which was basically one of the first communities for teens by teens to talk about mental health. And that really inspired um, a desire to learn more about the mental health industry and tech and the internet for that matter. This was before Facebook, Snapchat, all those things were really popular. We were on forums at the time, but really enjoyed the opportunity to connect with other teens. And so that led to me majoring in entrepreneurship in college, which my parents are entrepreneurship, excuse me. But I knew that I wanted to build solutions in this space. And so I had started a mental health tech startup in college. It was basically mental health homework for patients, adolescents, and adults, as well as analytics for the providers. And so that process was, I mean, it was a little bit of everything to building the solution and partnering with partial day and residential programs and understanding how patients wanted to engage with a product and really talk about drinking from the fire hose as somebody's first job. But I did that for a few years and then eventually moved into working at a large behavioral health EMR vendor, and so was supporting large health systems, psychiatric units, substance use facilities with their electronic health record software and all sorts of other products and services. So really got a better understanding of the healthcare system working on the within a large company like that. But ultimately wanted to go back to startup life eventually. And so that's when I moved to where else? San Francisco for that. And since then, it's been about 2 years. I worked for a different fund before the one I'm at now, where we were acquiring digital health startups. But in the last year, I've been spending time supporting two funds, actually. One, Launchpad Digital Health, which invests in early stage digital health startups, basically seed to Series A and B companies. And then the other one is called the Telocity Fund, which is focused exclusively on youth mental health tech. It's so really exciting time. I'm sure you've seen just so much has changed in mental health tech the last couple of years, and so has been really exciting working with them as well as a bunch of different behavioral health vendors. And so that, and finally, I did say the abbreviated version. I am also the co-author of the Rethink Behavioral Health Innovation newsletter, where we write about all sorts of innovations in the space each month.
Amazing. You are quite the talented person.
Thanks.
It's incredible. It really is incredible. And I think what's really wonderful about it is I think you're right. I think we are merging in that direction, right? Mostly because people specifically who have OCD have never met anyone with OCD, right? They don't even, actually, they don't even know, often they don't even know they have it. And through technology, that's how they originally find it. So I love your story. I love your story. And I'm so excited to pick your brain. So can we get to some questions?
Totally.
Thank you. I'm so excited. Okay. So from your point of view, particularly with your skills, how do you feel we can use technology, particularly for the person who has a mental health, struggle that they're going through? What's your thoughts in terms of how we can use technology?
Oh my gosh, where to start? Um, I mean, even just thinking about the different types of stakeholders in the healthcare industry that are adopting these tools to ultimately support consumers. I mean, it might even be consumers seeking out and purchasing digital health solutions for their own mental health, which is now becoming a little more acceptable, which I think the mindfulness trend really helped transform. It could be provider organizations, it could be caretakers or family members, health plans and employers and schools. A lot of these different stakeholders are adopting technologies to ultimately support end users with their mental health. And some of the ways that the end users are interacting with technology, I mean, that could be anything from practicing skills, learning psychoeducation about their condition. Could be once you learn it, how do we reinforce those skills with content through various apps? It could be through you even mentioned earlier through peer support, a lot of new platforms like that. It could even be finding providers to help them in their region or beyond. So many different ways that technology is being used for mental health now.
Right. Yeah, exactly. And so, from your perspective, like you've given us an idea of how many people can be reached. What were the specific advantages, do you think, for particularly the sufferer?
Oh, yeah. Well, I'm thinking of even the example you brought up earlier. Like, yeah, I had no idea what I was experiencing as a teen. I didn't know it was OCD. And my parents, being immigrants, neither of them even had the phrase obsessive compulsive disorder in their vocabulary, neither language. And so that took a lot of time. But ultimately, once I figured that out, which through what I think was just Googling and finding my symptoms and thinking, oh, wow, that might be it. Then from there, finding a community. I mean, really, one of the first times I actually met somebody else with OCD was probably like 5 years later when I went to an IOCDF conference in Chicago. And that was really mind blowing to me because not only was there one other person with OCD but like an entire conference filled, and I can't tell you what that meant to me in feeling heard and understood in what I'm going through, just because OCD is so misunderstood, and how it's presented in media, and really have felt so alone in that process. But being able to access a community like that, and then now, when you add technology to the mix, I mean, different platforms like NoCD, for example, not everyone can go out and even discover the IOCDF or other conferences like that or have access to go to them. But to be able to have a resource like that at your fingertips where you've got peer support and content, it's really it makes a huge difference. So yeah, access to getting the help that they needed pretty instantaneously, I would say, is a huge feature of technology.
Right. Yeah. And from a clinician's perspective, I think, I think from my experience 10 years ago, most therapists I met hadn't not heard of OCD except for hand washing either. So I think technology from a clinician standpoint has allowed us to sort of educate people about, you know, different types of OCD that people don't think are actual OCD. Unfortunately, the miseducation is still there. What about in terms of higher up in the system? What are the advantages there?
Yeah, more in the sense of like appropriate levels of care and how folks can, yeah, I think technology certainly can play a role there. Whether it can serve as an entry point for individuals to maybe have something while they unfortunately wait for a provider if there isn't a resource in their region. It could be something that they get started with, but if they need an escalation, maybe they have gotten more acute symptoms, then they can step up into getting higher levels of care. And then, even beyond that, let's say it's time that you're finally getting some relief. Perhaps it's a tool that you can use in maintenance mode ongoing. So, yeah, definitely lots of opportunities there.
Yeah, I agree. That's awesome. You've got a great perspective on all of that. Now, what are your thoughts in terms of how it helps us cut costs in the mental health field?
hmm Yeah, I think there are different perspectives about this, but even just the example I shared just now, making sure that we've got the appropriate level of care for somebody when they need it, technology could offer a really scalable solution that, especially talking about telehealth or other resources, if you eliminate some of those costs to provide face-to-face care and could offer something in the meantime through technology or an app or telehealth, that could certainly reduce costs. And sometimes technology can help individuals get more care than what they are receiving currently, which, that doesn't sound, intuitively, wow, doesn't that cost more? But if it means that we're offering the appropriate level of service for them, giving them the help they need to be able to prevent a larger catastrophe down the road, then yeah, it does make sense from a cost perspective.
Yeah, yeah. From the sufferer's perspective, someone who has a mental health issue, I think that benefit too is, I just recently spoke to somebody who had shared it's not just getting therapy that costs, it's me getting to therapy. The cost of travel, the cost of time, losing a day of work, and so forth. And I think that's a real benefit um, for getting the right services, but also cutting the cost. You can do it from home.
Oh, totally. I'm so glad you pointed that out. And, the fewer resources that folks have, the more those things really weigh on them. So I think that's a really important point.
Right, right. So tell us, I know you sort of touched on telehealth. Tell us about how telehealth is bringing a level of personalization into the mental health field.
Yeah, I'm definitely a huge fan. Just being someone who has leveraged it in my personal experience with therapy, uh, I think it's fair to say that the next generation is comfortable using virtual services more than ever. But really, I think, I've thinking even in my career, I've had more remote jobs than not. And that was driven by using tools like Zoom and GoToMeetings, and the quality of video technology has advanced so much that really I think it provides a more seamless experience. I know my local health system here in California, um, I've had the opportunity to do most of my visits through telehealth. A lot of those things I probably would have put off, candidly, just knowing what it takes to take the time off and go do this in person. And so I've had the benefit of using that, and with a busy schedule of traveling a lot, it's meant a lot to me. There was a period of time when I was in New York and I was having a hard time finding an OCD specialist, and was able to use a virtual tool until I could find someone. And so already right there, so many examples of telehealth making a huge difference. And I will also say, it's not just millennials that use telehealth and virtual platforms. I do think that all sorts of generations are actually becoming more comfortable with the technology.
Absolutely. And particularly, I think for people specific to have OCD, a lot of the treatment involves the home,
Mm.
right? Exposure to areas of the home, objects in the home, certain procedures that they have to get through, routines. So having telehealth is sometimes beneficial, even if my client lives down the street, for that reason, right?
I didn't even think of that. I never actually had done any kind of exposures through telehealth, through sessions like that. But of course, that makes so much sense now.
Right.
Yeah.
Yeah. And it's true for social anxiety. A lot of my social anxiety clients will be on the phone as they're, going into certain stores and practicing, engaging. There's so many ways in which we can use telehealth for different disorders as well.
Yes, totally. Yep.
Amazing. Right. Where, in terms of technology, how do you see that it will help specifically the OCD community in terms of sharing information, getting the correct care?
Hmm. Yeah. Well, we talked about a lot of them already. That's well, yeah. Outside of digital resources to be able to practice exposures through various apps. It could be connecting with others who also suffer from OCD. It could be tapping into different communities. And I think you had mentioned talking a little bit about different online communities and newsletters. And I certainly have one, a great community that we've been building through Rethink Behavioral Health Innovation that, who knew, like when I started this thing with Steve, we had no idea where it could go. We just thought, someone should cover this stuff. Lots changing in the space. And who knew that it would lead to so many, not only professional relationships and opportunities, but personal connections that never would have had before. And to the point earlier, when it comes to OCD, the experience can be so isolating. And so, any more of those types of resources, I'm absolutely in favor of.
Mm. Can you tell us a bit about your newsletter? I'm so curious.
Yeah, sure. It's surprisingly, it took us a long time to figure out a name, and we just, I feel like, came back to square one and said, okay, what is it we're doing? Okay, rethink behavioral health innovation. That is what we're covering. So let's that just be it. And so essentially, Dr. Steve Ramsland and I cover all sorts of different tech and startup news and innovation happening in behavioral health, everything from mental health to substance use to social determinants, care coordination, and each month just curate what's happening in the space. And then in addition to that, we also try to engage any kind of innovative organization or startup and interview them for our spotlight to give them an opportunity to connect with our audience that's typically made up of mental health entrepreneurs, VCs, and other investors interested in the space, MCOs, different health plan executives, as well as providers and clinicians.
Amazing, amazing. And how are you getting that information? How are you getting to know those people?
Yeah, it's through mostly events and just regularly going out and networking and hearing from folks what's happening in the space. By now, we've been doing this for a year, so people are emailing us for news that they'd like to feature. just curating what's already being published, and so it's a little bits and pieces of all of that, but it's pretty grassroots effort, to be totally candid.
Right. I think that the reason I find that so fascinating is people are now so, back from a clinician's perspective, we were trained to just, be this blank slate and um, just provide care, and that's what we're trained in. And now there's all these therapists and trained professionals like yourself coming up and creating new ways to sort of look at this problem and address it. I find it so fascinating that we're at this place. It's so exciting.
Oh, that's so true. And there are, I mean, now there are different groups and like studios that are tackling these problems. Like Hope Lab is a good example. They're an innovation lab that develops solution just for underrepresented youth, and have a huge focus on emotional and mental wellness. The Headstream Incubator, which we'll be featuring this month for our spotlight, they've got an incubator exclusively for youth mental health and wellness innovations. Yeah, definitely an exciting time.
Yeah, it's really, really exciting. So this is a big question, but I'll let you go as wild as you like. Where do you see the mental health tech industry in 10 years?
Oh man. Okay. Yes, that definitely could. I mean, that could go many directions, especially with every new, even just every new general technology advancement and release, to consumer sentiment and the development of new payment models and policy changes. So many of these things can impact where behavioral health, digital health is going to go. So I guess if I could hone in on even just one thing that I would at least hope for, is that builders and developers of solutions would, over time, as a lot of these digital health startups start to mature, that they would get, as they get more usage and data, would have a better understanding of the populations that they're impacting and could tailor their solutions a lot more. Maybe that means a more grassroots effort, and particularly, I'm excited that there's more focus on underserved markets. But what does it mean to be able to develop solutions for them that are going to work for them and their needs? Maybe that means more talking to the community organizations that they're already working with. But I think over time, as they get to accumulate more data, that they'll be able to personalize the solutions a lot better, as opposed to more blanket tools that, especially mental health tech, I think still could use more maturation in that regard.
Mm-hmm. What do you think about in terms of the development or improvement of mental health stigma related to technology? How do you think technology is impacting this ongoing stigma that we're experiencing?
Yeah, it's interesting because, on one side, the proliferation of social media and all of the, Calm and Headspace unicorn apps and startups have gotten so much attention in a positive way, that I think the next generation is, I mean, Silicon Valley, it's almost, it's uncool if you don't have a therapist now. So, yeah, I think it's neat that conversations are spreading so quickly to promote mental health care in that way. But at the same time, I'm concerned that, unfortunately, there's still a lot of stigma, such that a lot of these digital health startups, for example, target employers to adopt their tools. But, I still don't know if really employees are ready to embrace that, uh, not knowing who has access to the data and what repercussions can happen. And so I still think that a lot of work needs to be done in that area. But one way that I've seen some companies break through that is, um, while they are looking to address behavioral health um, as the underlying issue, they are marketing their solutions as less stigmatized resources like, um, let's say you want to manage your diabetes, or this is a sleep app, or it's something else, but they have underlying tools and resources and science that's supporting the mental health advancement. And so I think that's a start. That's one way, and hoping to see more of that.
Amazing. Yeah. I think by even seeing these startups, I think is setting a precedent that, this is the direction we're going, and it's okay if this is what you're experiencing. I think that just having the startups helps us sort of bring the conversation to the table a little bit more.
Yeah, and hopefully there'll be a day where we're just talking about healthcare startups, and mental health will be so much more integrated in healthcare than it has been, that it won't be such a subset that it is, but that takes time.
It does. It does. Well, Solome, I have loved speaking with you. You are uh, so much information and so much knowledge. It's very impressive. Tell us where people can go to find out more about you and what you do.
Thanks so much. Yes, active on Twitter. Sometimes I'm talking about mental health industry. Sometimes I'm talking about what's for breakfast. But regardless, it's usually entertaining, and it's just my full name, Solome Tibebu. I'm also on Medium, and then of course you could subscribe to the Rethink Behavioral Health Innovation newsletter at rethinkbhi.com.
Amazing. Thank you so much for your time.
Awesome. Thanks a lot, Kimberly. Always a pleasure. Really appreciate it.